here's the thing nobody puts in the retirement brochure. Retirement can be expensive, like seriously expensive. And if you're not planning for the right things, you could find yourself at 72 doing something nobody wants to do at 72, going back to work. So today, we're breaking down the biggest expenses you'll face in retirement, the ones that sneak up on people, drain accounts faster than a teenager with a credit card, and honestly just don't get talked about enough. Before we dive in, let me give you the big picture. The average American retires at around 62 to 65 years old. And if you're in decent health, you could be looking at a 25 to 30-year retirement. That's a long time. Now, you've probably heard the old rule of thumb. You'll need about 70 to 80% of your pre-retirement income in retirement. Because, hey, you're not commuting anymore, you're not buying work clothes. Life is simpler, right? Wrong. Or at least not always right. For a lot of people, especially in the early years of retirement when you're healthy and active, spending actually goes up. Because now you have time. And time, my friends, costs money. So let's talk about where that money actually goes. I've got 7 major categories for you. Some will be obvious, some will genuinely surprise you, and at least one is going to make you want to call your financial advisor immediately. I'm Maddie, let's get into it. Number 1, healthcare. All right, we're starting with the one that keeps financial planners up at night, healthcare. If you are retiring before age 65, meaning before Medicare kicks in, you are in what I lovingly call the coverage gap danger zone. You're too young for Medicare, potentially off your employer's plan, and private health insurance for a 62-year-old? It ain't cheap. We're talking anywhere from $500 to $1,500 a month or more, depending on your state, your plan, and how the insurance gods are feeling that day. But even after Medicare at 65, you are not done paying. Medicare has premiums, deductibles, and copays. And here's a fun little surprise. Medicare doesn't cover everything. Dental, largely not covered. Vision, mostly not covered. Hearing aids, you're basically on your own. So let me get this straight. The population most likely to need dental work, vision correction, and hearing aids is the population Medicare covers the least for those things. Cool system. Very cool. And don't forget long-term care. We'll get to that in a minute, but keep it in the back of your mind. What to do about it? First, if you're retiring early, look at your options. COBRA, the Affordable Care Act marketplace, a spouse's plan if available. Know what you're getting into before you hand in that resignation letter. Second, consider a health savings account, HSA. If you're still working and have access to a high-deductible health plan, max that thing out. HSA contributions are tax-deductible, the money grows tax-free, and withdrawals for medical expenses are tax-free. It's basically the Swiss Army knife of retirement healthcare planning. Third, and I cannot say this enough, Medicare planning is a whole thing. There are supplement plans, Medicare Advantage plans, Part D for prescriptions. Get educated on this stuff before you turn 65, not after. Number 2, housing. You might think, Maddie, I'll have my mortgage paid off by retirement. Housing won't be a problem. And listen, maybe that's true, but owning a home doesn't mean housing is free. It just means the costs look different. Let's think about this. That home you bought 30 years ago is now 30 years old. The roof needs replacing, the HVAC system sounds like it's auditioning for a horror movie, the kitchen is, let's call it vintage, and that deck out back, one wrong step and you're starring in a home renovation GoFundMe. Home maintenance and repairs are real ongoing costs. A commonly cited rule is budgeting about 1% of your home's value per year for upkeep. So if your home is worth $400,000, that's $4,000 a year, not renovations, just keeping it from falling apart. Then there's property taxes. These don't stop because you retired. In fact, they tend to go up over time. Depending on where you live, this could be a few $1,000s a year or a lot more. Some states have property tax breaks for seniors. Definitely look into what's available in your state. And then there's the big question. Do you want to stay in your home? Downsizing can free up equity and reduce expenses. Moving to a different state might cut your tax bill significantly. Some people even go the full sell everything and travel route, which honestly sounds amazing until you realize you still need somewhere to put your stuff. What to do about it? Do a real assessment of your home's condition before you retire. Get ahead of big repairs while you still have regular income. If downsizing makes sense for your situation, run the numbers. The savings can be significant. And research your state's senior property tax exemption programs. Save money, people. Save that money. Number 3, food and lifestyle. Okay, now we get to the fun stuff, which is also, ironically, where a lot of retirement budgets quietly explode. Here's what happens. You retire, you suddenly have time, like all the time. And you think, I'll finally travel. I'll eat at that nice restaurant I always walked past on my lunch break. I'll take up golf or sailing or collecting vintage wine, or all three. And you should. That's what retirement is for. But those things add up fast. Let me paint you a picture. Pre-retirement, you ate lunch at your desk 4 days a week because you were too busy. Post-retirement, you're going out to brunch with friends 3 times a week because what else are you doing at 10 a.m. on a Tuesday? Totally valid. Also totally a line item in your budget now. Travel is one of the top things retirees say they want to do, and travel is expensive. The early years of retirement, while you're healthy and energetic, are often called the go-go years. This is when people spend the most. Think cruises, international trips, visiting grandkids across the country. Some financial planners actually build in a higher travel budget for the first decade of retirement precisely for this reason. Hobbies also deserve a real budget. Golf clubs, green fees, country club memberships. Golf alone can cost thousands of dollars a year. Pickleball is cheaper, and I'm told it's rapidly becoming the official sport of retirement, so there's that option. What to do about it? Build these expenses into your retirement plan intentionally. The worst thing you can do is pretend you won't spend money on fun and then blow your budget in year 1 because you didn't account for it. Give yourself a lifestyle budget and enjoy it without guilt, but know what that number is before you're living it. Number 4, long-term care. This is the one, the uncomfortable one, the one where everyone kind of squirms in their seat and says, "Oh, I'll be fine," and then changes the subject. But we need to talk about it because long-term care is potentially the most financially devastating expense in retirement. Here are the stats. According to U.S. Department of Health and Human Services data, roughly 70% of people turning 65 today will need some form of long-term care at some point in their lives. 70%. That's not a small edge case, that's the majority. Now, what does long-term care actually cost? We're talking about things like home health aides, assisted living facilities, and nursing home care. The numbers are not small. Depending on your location, a private room in a nursing home can run $8,000 to $10,000 a month or more. Assisted living facilities might be $4,000 to $6,000 a month. Even in-home care with a part-time aide can add up to thousands per month over time. And here's the surprising thing. Medicare does not cover most long-term care. Medicare covers some short-term skilled nursing care under specific conditions, but ongoing custodial care, that's largely on you. Medicaid covers it, but to qualify, you generally have to spend down most of your assets first. So basically, the system is save your whole life, accumulate assets, then spend most of them on care before the government helps you. Great plan, everyone. Really proud of this one. What to do about it? There are a few strategies here. Long-term care insurance is one option, though it's gotten expensive and harder to qualify for as you age, so if you're going to get it, younger is better. There are also hybrid life insurance policies with long-term care riders that can be more flexible. Another option for people with significant assets is simply self-insuring, setting aside a dedicated pool of money specifically for potential long-term care needs. Either way, have the conversation with your family and your financial advisor. Putting your head in the sand on this one is genuinely one of the most expensive financial mistakes a retiree can make.
Number 5, taxes. Surprise, retirement doesn't mean you stop paying taxes. I know, I'm sorry. Here's what a lot of people don't realize. Many of your retirement income sources are taxable. Traditional 401k and IRA withdrawals, taxable as ordinary income. Social Security benefits, up to 85% of your Social Security benefit can be subject to federal income tax, depending on your total income. Pension income, generally taxable. Capital gains from investments, potentially taxable. And then there's the required minimum distributions, or RMDs. Once you hit age 73, the IRS requires you to start taking minimum distributions from your traditional retirement accounts, and it's not really a request, and those distributions count as taxable income. Have a big 401k? Your RMDs could push you into a higher tax bracket, potentially affecting things like your Medicare premiums too, because apparently saving responsibly is something we have to pay for. What to do about it? Tax planning in retirement is a real discipline, not an afterthought. Think about Roth conversions in the years before RMDs kick in, paying taxes now at potentially lower rates to reduce your taxable burden later. Think about which accounts you withdraw from and in what order. Think about where you live. Some states have no income tax, no tax on Social Security, or significant retirement income exemptions. This stuff matters more than most people realize. Work with a CPA or a fee-only financial planner who understands retirement tax strategy. The savings can be substantial. Number 6, inflation. This one is sneaky because it doesn't show up as a line item, it just quietly makes every other line item bigger over time. Here's the thing about inflation. Even modest inflation compounds dramatically over a long retirement. At a 3% annual inflation rate, your purchasing power cuts roughly in half over 25 years. So if you need $60,000 a year to live comfortably today, in 25 years, you'd need around $120,000 to maintain the same lifestyle. That's not a crisis if you've planned for it. It absolutely is a crisis if you haven't. Retirees on fixed incomes are especially vulnerable. If your pension pays you the same dollar amount year after year with no cost of living adjustment, inflation is slowly eating your purchasing power every single year. You're not getting poorer on paper, but you're getting poorer in the grocery store checkout line, and that's what actually matters. Social Security does have a cost of living adjustment, or COLA, which helps, but it doesn't always keep pace with the actual inflation that retirees experience, especially healthcare inflation, which consistently outpaces general inflation. What to do about it? Keep some portion of your retirement portfolio invested in assets that historically outpace inflation over time, stocks being the primary one. Yes, I know the idea of keeping money in the stock market in retirement is scary, but a 30-year retirement is a long time horizon. A portfolio that's 100% bonds or cash in your 60s may feel safe, but could be slowly evaporating in real purchasing power terms. It's a different kind of risk, a slower, quieter one. Talk to a financial planner about a withdrawal strategy that accounts for inflation over your full expected retirement horizon. Future you will thank present you. Number 7, family. And finally, the wild card, the one that's impossible to predict and very hard to say no to, your family. Retirement-age Americans are increasingly being called the sandwich generation, caught between adult children who might need financial help and aging parents who might need support. And even if that doesn't apply to you, there are grandkids, family vacations, weddings, holidays, and all the beautiful, expensive chaos that comes with family life. A quick word on adult children. It is incredibly common for retirees to financially support adult children in ways they hadn't planned for. A kid loses a job, has a medical issue, goes through a divorce, and suddenly grandma and grandpa are sending checks. The impulse is completely understandable. The financial risk is very real. And look, I'm not saying don't help your family. Of course you're going to help your family. But there's a difference between helping from a position of financial security and helping in a way that quietly compromises your own retirement. One of the saddest things a financial planner can witness is a retiree who ran out of money not because of bad investments or poor planning, but because they gave it all away to people they loved. What to do about it? Have honest, early conversations with your family about your financial situation and your limits. This doesn't mean being cold or withholding, it means being realistic about what you can sustainably provide without putting your own retirement at risk. You cannot pour from an empty account. Make sure your financial plan includes a realistic estimate of family-related expenses, because pretending they don't exist doesn't make them go away. It just means you get surprised by them later. Retirement is genuinely one of the greatest things you can work toward. The freedom, the time, the ability to actually live on your own terms, it's worth every year of saving and planning and delayed gratification. But it's also expensive, in ways that aren't always obvious and in ways that people consistently underestimate. So here's the quick recap. The common thread through all of these: planning beats reacting every single time. The people who navigate retirement comfortably are almost never the ones who made the most money. They're the ones who planned the most carefully. If you're not sure where to start, consider sitting down with a fee-only financial planner. Tell me in the comments, which of these 7 expenses surprised you the most? And if retired, where are you spending the most? I will be reading. Thanks as always, and I'll see you in the next one.